Good morning, everyone. Happy Tuesday morning. I'm Chris Trumbauer with the County Exec's Office. We're going to get started with our weekly press conference in just a moment. We'll have remarks from County Executive Pittman and then Dr. Nilesh Kalyanaraman, followed by media questions. So with that, I'll turn it over to County Executive Stuart Pittman.
Thank you, Chris. Thank you for joining us, everybody. I guess I want to start out talking about COVID case rates. We're over 19 now after getting down around 13, coming from pretty close to 60. So we've been heading in the wrong direction. And I know that some people are questioning whether the governor made the right decision to lift restrictions at restaurants and retail, whether I made the right decision as well to take that step in Anne Arundel County, and I want to talk about that. In the fall, what we did was we looked at the hospitalization projections as the primary determinant of what we should do in terms of restrictions. And those projections at the time, Johns Hopkins was saying were that we may have more COVID patients than we actually had hospital beds, which would have been a catastrophic scenario. So we acted, we had stronger restrictions than the state. The state acted as well, and most of Central Maryland acted and kept those numbers down. What we have now is, fortunately, a very different kind of a scenario and very different kinds of projections for hospitalization. I think we have a chart that we can show. Do we have that, Jenny? Yeah. So fortunately, whichever reopening you look at, and I know there's another slide that shows pace of vaccination. They don't project that we're going to get much above 1,000 COVID patients across the state in our hospitals. And you can see we were pretty close to 2,000 in the last surge. So that changes the situation for us because we're vaccinating and because we're continuing to wear our masks and social distance. So I think that's the difference now. There is always the risk of the variant, and I know that Dr. Kalyanaraman may talk about that, but I don't want people to feel like we're out of the woods by any means, but the science is telling us something different than it told us in the past, that because of the warmer weather, because we're vaccinating, and because we project an increased real acceleration of vaccinations, that this is supposed to be a short-term small spike and not a long-term large increase. So that's what we're acting on, and we're continuing to try to get our economy going. So I think the governor's decision was the right one. I would have waited a few weeks myself, but I think we're going to be able to get through this if everybody gets vaccinated when they have an appointment available and continues to mask and social distance, and I trust that they will. In terms of accelerating vaccinations, Anne Arundel County will be moving at the same rate as the state. All counties will be, in fact. That's the directive from the State Department of Health. So starting this week, residents 60 and older. Next week, 16 and older with state-approved health conditions eligible. April 13th, residents 55 and older and essential workers in state-identified industries. And then on April 27th, everyone 16 and older. And I also want to thank the governor for setting these dates in advance so that providers can plan and residents can plan and get a sense of when they're at least going to be eligible. And the good news also is that everybody's projecting that the supply of vaccinations will be increasing pretty drastically in the coming weeks, so that we'll be able to provide vaccinations to those groups. And I believe that our county, our health department, and our partners, private sector and nonprofit, are prepared for this huge increase in vaccination activity in the coming weeks. We have gotten the data finally from the state to be able to scrub our pre-registration list. So we had a lot of people in our aacounty.org/COVIDvax pre-registration list that had been vaccinated elsewhere. And once we got the data on who had been vaccinated elsewhere, we were able to remove about a third of the people from our list. So with 45,000 fewer, we have still pretty close to 85,000 active pre-registrants waiting for vaccinations. So we are ready to move when we get those doses. And the other good news is that we're going to have another 1,000 doses this week. So rather than 3,400 or 3,500 or 600 in a couple of cases, we'll have 4,400 coming to the health department. So pretty much good news everywhere on the COVID front. I want to mention a few other things. The Rec and Parks, which is probably one of the most popular departments of county government, that gets the most demand from residents during budget town halls and every other time of year for additional funding and additional parks, land to be purchased and preserved, and facilities to be constructed, is starting their land preservation and LPPRP, now I'm forgetting what it is, land preservation, recreation, parks and recreation plan, that's it, LPPRP. And you can go to aacounty.org to get the link to be able to have public input into that process. There are going to be a series of meetings as well. And we're always excited about this process because it's near and dear to my heart and to the residents' heart to preserve open space in this county through this plan and to provide recreation and sports activities for our residents. General Assembly crossover deadline was last night, and I'm thrilled to report that all three of our priority bills survived. In fact, all three have passed both chambers in some form. There are some amendments that need to be made on one side or the other to be able to get them in their final form, but we're confident that they will pass. So we have our Tax Relief for Working Families Act that allows some progressivity within our income tax brackets at the county level, which we're looking forward to figuring out how to use once it passes. We have our Housing Trust Fund bill that will allow us to begin funding, if we get the county council to approve, a housing trust fund for affordable housing through real estate transfer tax on properties over $1 million. And then our Visit Annapolis bill that allows local government and the taxpayers to oversee the spending at Visit Annapolis. So good news on that front. And then also good news, if anybody missed it, on our bond sale was very successful. We got great rates, $37 million saved for taxpayers. And you know, that along with the good bond ratings we got, we're still trying to convince. I believe that that Moody's should agree with S&P and give us a AAA. We have a strategy to try to convince them of that before the end of my first term, which included maxing out our rainy day fund at 5%, the maximum we're allowed to do. We put that money aside just recently, and we're working with the council on legislation to increase that cap to 6%. And we believe that that will help us, particularly with the investors out there. Want to thank, for anybody who missed this, our Department of Public Works for coming to the rescue at Lake Waterford when sediment was pouring into the water and covering up the yellow perch eggs there. And I've been in contact with Secretary Grumbles. This site was identified over a year ago by our inspectors, and we asked MDE that permits the nearby site from Ecology Services to do something about the sediment coming off of the place where they park those trucks, those trash trucks. And Secretary Grumbles responded immediately and said it was a top priority for him. He's going to meet me out there this week, and we're going to make a plan to prevent this from ever happening again. I'll also be up in the neighborhood on Friday this week at Downs Park doing the ribbon cutting for their new playground, as well as the groundbreaking for the new Rivera Beach Library, as well as visiting some additional sites where there has been failures of erosion and sediment control up in that neighborhood. And then finally, I just want to mention that tonight we have what is normally Tuesday night with the county executive, but I have been bumped from the host position by my chief of staff, Dr. Kay Bodges de Brown, and she is she's hosting the topic of women in charge, and she will have our all-women public safety team of Police Chief Amal Awad and Fire Chief Tricia Wilford and Office of Emergency Management Chief Director Preeti Emmerich. And they're going to be talking about their careers as part of Women's History Month. And looking forward to that. And finally, I want to say goodbye to another very successful woman who works for the Capitol, Olivia Sanchez, who I understand today is her last day. And I want to thank her, the Capitol, and her for doing a good job of holding us accountable and covering the work that we do in county government. So over to you, Dr. Kalyana Raman.
Thank you, County Executive. Start with some of our data. With COVID, we have seen our case rate go up to 19.8 now. And we're seeing more concerningly that our hospitalizations are going up as well. Our occupancy was down in the mid 70s and now it's at 80%. We have about between the two hospitals, a total of about 68, I believe, people who are hospitalized. And when we look at the data, what we're seeing is that in early January, like the first couple of weeks of January, we saw that the age group with the highest number of admissions was in the 80 plus category. That's now the 50 to 59 age range. What that shows us is that the vaccines are really working in keeping people from getting hospitalized. And we say that because we've obviously prioritized those at the highest age range. But I think it's a good reminder to folks that if you haven't been vaccinated, the risks are still out there for you. So please hold on. We are getting more vaccines. So not just the health department, we're getting 4,400 doses, and just 2 weeks ago, we were only getting 3,400 first doses. Other entities are getting more doses. So we're really talking about in a couple of months, at some point in May, we really will be able to say, anybody who wants one can get one. And the governor has set April 27th as the day where we open it up to phase 3. And that's all groups are eligible. So please, particularly if you haven't been vaccinated, please limit your activity. It's only a few more weeks or months at most. And then even if you have been vaccinated, continue to distance and mask because there are other people who haven't been vaccinated. When we look at our vaccination data, where we see that over 35% of residents in the county have had at least one dose and 13% are fully vaccinated. We know that supply is supposed to increase in April, and it's already started at the tail end of March. So it's a really great sign for continued increase in vaccine supply. Everybody who's age 65 and over has been offered at least one shot of the vaccine who's on our pre-registration lists. We are in the phase 1C occupational portion. Last week, we invited postal workers, public transit, grocery store workers. This week, we're going to invite the remainder of the occupations: critical manufacturing, food and agricultural production, clergy, and veterinarians. We're working with the hospitals on identifying folks with high-risk conditions who are getting hospital-based care. So those are your solid organ transplant, cancer, end-stage renal disease requiring dialysis, sickle cell, COPD, and diabetes. That category. And then starting with the next week, we'll start inviting the 60 to 64-year-old. We couldn't invite them this week because we send our invites out a week in advance. And so we'll continue to keep with the governor's schedule. And as the county executive noted, it's helpful to have a plan that we can tag ourselves to. At the same time, we've been talking a lot about equity. That's critical. And we've been focused on equity along with speed. It's why we are still the largest provider of vaccines to residents of the county. And at the same time, we've been focusing on those with the highest risk. And so that means continuing our work with the ARC to reach those with intellectual and developmental disabilities, continuing our homebound vaccination program. Our community vaccination clinics have been going really well. Those are in partnership with faith-based and community-based organizations. We've been doing 3 a week. We're going to be continuing that and hopefully expanding that program. We've been coordinating with Arundel Medical Center and Baltimore Washington Medical Center on their community programs as well. Starting yesterday, we started publishing disaggregated data by race and ethnicity on vaccine providers and vaccinations in the county to ensure that we are getting a full picture of what's happening, and that will allow us to better target vaccination services so that we are addressing inequities that might arise. Promisingly, we're seeing the percentage of Blacks who are being vaccinated increase, and it's right now at or near the percentage in the population, which is what we're looking for. For Hispanics, the percentage is lower, and part of that is because the average age is lower. And so there just aren't as many Hispanics in those higher age groups that we have been targeting. And so we've been putting into a lot of work into getting those relationships where they need to be so that once they're eligible, we're ready to go. And then lastly, we'll be expanding the areas that we are in. So we'll be at Pip Moyer starting this Friday, and that'll be continuing on Fridays. And we've expanded our days at the O'Malley Center as well. I'm going to end there and turn it back over to you, Chris.
Great, thanks, Doc. Thank you, County Executive. We're now going to start our media questions, and in honor of Olivia's last day, we're going to give you the first question, Olivia, if you want it.
Thank you very much. I guess if Bob Mosier's on the call, I'd be interested just to hear an update on how the hybrid reopening is going. And I think middle school started yesterday, if I have that correct. I'd just like to have an update.
Yeah, so thanks, Olivia. It's going well. We brought back students in grades 7, 8, 10, and 11 yesterday. So the 2 higher grades in our middle schools and the middle 2 grades in our high schools. So we have about 31,500 students who by the end of this week will be engaged in hybrid learning. We're continuing to look at the data and talk with the Department of Health about what we may be able to do to bring even more students back in as the restrictions get lifted or eased. We're looking at the latest CDC guidance to see what we may be able to do there, but it's going well.
Have you seen any positive cases from students or teachers since the March 1st reopening? We have.
We've created a dashboard, aacps.org/COVID-19 dashboard, which we update once a week with the cases that involve people who are in our buildings.
Thank you.
Sure. Any other questions from the media this morning? All right, I guess we just get the one from Olivia and sending her out in style. So thanks everyone for joining us. We will see you next week, same day, same time.